Welcome. I'm Kevin Flood, President and CEO of the LSU Health Sciences Foundation. I want to thank and welcome everyone for coming today, especially our media partners. I'll say originally we were going to hold this outside at the fairgrounds at our testing site there. We thought that'd be a nice backdrop, but then we looked at the weather and said, let's not do that. So I'm glad that we're all in the warmth of the Zadok Conference Center. So I want to thank you for being here for a very special and historic announcement. You know, in March of 2020, the LSU Health Shreveport Center for Emerging Viral Threat was created and has been our community source for all things COVID-19 related since then. So that's from much needed education and guidance to testing, to viral sequencing, to vaccine clinical trials. And now today, what's happening over at the fairgrounds is large-scale mass vaccination and testing. So it really has been the leader, not only here locally, but regionally and nationally, of our effort to combat the pandemic. So it's with great excitement today that I announced that LSU Health Shreveport has received a historic $1.2 million gift. This gift will fund the CEVT's first permanent endowment, which will provide ongoing crucial funding for its vital work. This gift has been made possible by 4 different groups, and we have most of those individuals here today, and some of them will speak. Those 4 individuals or groups are Gigi and Dewey Corley, who have given through their Chaparral Foundation, Margaret Place Properties, Francis and William Comages III, and then the family of Aaron and Peggy Selber. So I want to thank those that are in the audience today for this historic gift. Your foresight in making this type of gift is really going to lead the way, not only in what the CVT is doing as a center to combat the pandemic, but it's also going to show others the impact that donors can have and private individuals can have on the work that LSU Health Shreveport does. So thank you for making this possible. At this time, I'd like to call forward Dr. David Lewis, who's our interim chancellor and dean of our School of Medicine, to make a few remarks. Dr. Lewis.
Thank you, Kevin. I'm going to keep my remarks very short today. First of all, welcome to LSU Health Shreveport on this cold day. It is a historic day, and I want to welcome each and every person that's here. I also want to personally thank the donors. These types of gifts really take us to the next level. And, you know, the EVT lab, which Dr. Kevill will talk about in a moment, has really just been a blessing to this community. And the number of tests that they've done, the number of vaccines that they've been able to do, and be able to really pivot in a very short period of time to really meet the needs of this community during this period of time has just been remarkable. The gift that has been donated here really is what takes institutions like ours to the next level. This will be something that will be an endowment, and it will give year after year after year throughout the history of this institution, long after COVID. Although I'm sure there are going to be other viral threats out there, and that's really what this gift is all about. And so, in closing, thank you for being here. Thank you to the donors, and go Tigers.
Thank you, Dr. Lewis. At this time, I'd like to call forward Dr. Chris Kevill, who is our Vice Chancellor for Research and Dean of the School of Graduate Studies. Dr. Kevill.
Thank you, Mr. Flood and Dr. Lewis, and most importantly, thank you to the donors. As Dr. Lewis just said, without this generous donation, really all of the incredible hard work from everyone here at the Academic Medical Center at LSU, as well as in the community, really couldn't be sustained and have a long-term trajectory for not only stability, but more importantly, growth as we endure through this current pandemic and then perhaps maybe have to deal with others in the future. But what I'd like to do is just take a few moments and kind of give you some perspective of why this gift is so important and the impact that the Center for Emerging Viral Threats has had thus far. As many of you know, and you heard earlier from Mr. Flood, back in March of 2020, there was a gentleman, Dr. Andrew Urachko, that sent me an email that says, boy, you know, we really think we can help test for this virus. At that time, many of you probably remember that there wasn't a way to get a test. You couldn't figure out if you were infected with it or not. And that was a big problem because we knew this virus was going to run rampant throughout the population. And our scientists, our physicians, our technical staff, our scientific staff, all rallied together to make this a reality. Since then, we've ran over 344 PCR tests. We've tested 62 of the 64 parishes in the state of Louisiana. We were one of the first to launch in the whole state, so we ended up getting a lot of samples from across the state. And more importantly, we've done over 436,379 PCR tests in the nursing homes. One of the things that in working with Governor Edwards' administration is we realized we needed to protect the most vulnerable, and his administration was really indispensable in helping us do that. Importantly, we really pivoted to the importance of surveying and doing genomic sequencing to determine what the virus actually is. And to date, we have been doing over 10,000 genomic sequences on all the viral positives. That represents greater than 47% of all of the sequencing in the state of Louisiana. So that is huge because it's allowed us to interact with the Centers for Disease Control, allowed us to interact with the Rockefeller Foundation, some of you may know of, and also has allowed us to interact with the National Institutes of Health, all of which are now giving us additional funding. So everything that started there really is blossoming into something new. And where does this really go? Well, as you heard a moment ago, vaccinations are the key. That's the thing that's going to help us live with this virus and perhaps actually get out of this pandemic. And indeed, CEVT has given over 118,307 vaccines and counting. We know that boosters are critical, and that really helps us combat not only the Omicron, but previous version of the virus, and perhaps maybe even the future variants that come. I could give you a litany of many other things that this CEVT has done, but without the support of the community, there's just no way it would have been possible. So I will close and again thank all of the donors for their kind generosity and the community for your continued support. Thank you.
Thank you, Dr. Kevill. I'd now like to ask Dr. John Van Cherry to come forward and share a few words with us. Dr. Van Cherry is really the boots on the ground for the operations for the CEVT. He's Director of Testing and Vaccinations for us. So, Dr. Van Cherry.
Thank you, Mr. Flood. It's a pleasure to be here with all of you, and also want to give our sincere thanks to the donors, the families who have supported us and continue to support us. This is a visionary gift. This is a gift to take us really to the next phase, to get through this pandemic and be ready, more hopefully better prepared for the next one, because they will continue to come. And I speak on behalf of many who have been a part of the teams working in the nursing homes, our local prisons, all across Northwest Louisiana, and in our schools where we have ongoing testing and vaccination programs. We're talking several hundred individuals, nurses, medical students, nursing students, paramedics, EMTs, all healthcare workers, and technical staff across this area of the state who have supported this work. It goes back to early in March of 2020 when Dr. Martha White called and said, hey, can the medical school help out because the nursing homes have COVID? And the answer was yes, and we continue to say yes and respond to the needs of the community. And it's again the vision of this incredible gift that will allow us to continue to say yes to our community. So we do appreciate all of your support and ask that others in the community, please, when you're ready, step forward and participate in this program. So thank you very much.
Thank you, Dr. Van Cherry, for all that you do for us on a daily basis with this pandemic. Our community, and many times, needs visionary thinkers, visionary leaders, people who are not afraid to step forward and say that I want to make a difference. And an individual who fits that description is Dewey Corley. I've known Dewey for many years, and he's been involved with many different things in our community and specifically with LSU Health Shreveport. But he's really made it his mission to make sure that our response to this pandemic and others is the best that it can be. And so it was really through his vision of making this gift is why we're here today. So I'd like to ask Dewey to come forward just to share a few comments with us.
Thank you, Kevin. When the pandemic showed up over 2 years ago now, we've watched it, and Gigi and I were terribly impressed with the leadership that the LSU Health Shreveport showed in addressing it. First, with a robust testing and vaccination program in the nursing homes, in the more vulnerable members of our community, and in the medically underserved sections of our community. And right on top of that, they instituted a rigorous testing and vaccination program for the entire community and beyond that throughout the state. I learned and was introduced to the center largely through Dr. Vancheri and Dr. Kevill, and learned what they were doing, and that all these efforts are really the results of the LSU Health COVID-19 strike teams that were sent out, and the Center for Emerging Viral Threats, which was newly established at that time. Over that time, the center has grown in prestige. It now holds a Center of Excellence recognition from the Board of Regents, but more importantly, it's recognized pretty well throughout the U.S. and international medical community as one of the premier centers for addressing viral threats. To have that capability here in Northwest Louisiana is absolutely amazing to us. If we learned anything over the last 2 years, COVID-19 and its Delta variant and its Omicron variant won't be the last viral threat we face. And so having the capability and the talented team that can identify, analyze, sequence, and get prepared for those things is going to be critically important in the development and distribution of tests, vaccines, and therapeutics the next time that they're needed. So Gigi and I are very proud to be a part of helping establish this endowment, and we hope that others in the community, as they learn about it, will give thoughtful consideration to supporting it, because I think this is an amazing resource that we have here. Thank you very much.
I'm going to go ahead and just say it now. I think Dewey needs to be our official spokesperson for the CVT, right? Marketplace Properties was an entity that was created several years ago whose sole mission really has been to also support LSU Health Shreveport. A key member of that group was Ray Lassane, and through Marketplace Properties, it has made a significant contribution as well to this gift. So I'd like to ask Ray to come forward to say a few words. Ray has been a staunch supporter of the entire LSU system. He has served as the chair of the Board of Supervisors for LSU, but more importantly for us, he's one of us, and he has supported LSU Health Shreveport wholeheartedly. He currently serves on the foundation board. Ray, thank you for all that you do for us, and say a few words.
All right. Thank you, Kevin, so much. And it's hard to follow Dewey. He said it all. So thank you so much. I agree 100%, Dewey. I stand here representing the three men that worked very closely and diligently with the LSU Health Shreveport leadership to save the old Schumpert Hospital and prevent it from being demolished. As many of you know, it was on schedule, and we worked hard in a very short period of time to save that. That effort, like the one today, highlights the significance of seizing the opportunity for the betterment of our city and for our medical school, which is a real crown jewel in our area. When I look at everything that's happening here on this campus, especially from my viewpoint as a former chair of the LSU Board of Supervisors, it excites me when I recognize the critical role played by LSU Health Shreveport and all of the gentlemen that have already spoke, and everybody else, your entire teams, the staff, the faculty, everything y'all have done to be a leader in the state in this battle against COVID. This Center for Emerging Viral Threats will serve to further research and will bring significant funding and grants to this medical school to support that research. I want to publicly thank all of you and all of your staff, you people that worked. They're all heroes. They saved lives. They impacted our community, our economy, and most importantly, they provided hope for the future. So thank you to all of you. Margaret Place Properties proudly and enthusiastically provides this contribution to the endowment in support of the Center for Excellence for Emerging Viral Threats. So thank you for all you do and all of the great things to come, and look forward to supporting you any way we can.
Ray literally gave you the check, so I like that. Ray, thank you. Next up is Bill Comages. So Bill holds a lot of hats as well, wears a lot of hats as well. One of which is he's part of Marketplace Properties, the board there. He's on the foundation board as well. He's been heavily involved with activities at the LSU Baton Rouge campus. But again, most importantly, he's one of us, and he supports LSU Health Shreveport wholeheartedly. Bill has made a personal commitment to this gift as well. So I want to thank you, Bill, for what you've done, and if you'd like to say a few words.
Thank you, Kevin. Francis and I are native Shreveporters. We love this city, and the LSU Health Science Center Shreveport is probably the crown jewel of the Shreveport's economic development, plus care for the medical community. The CEVT, I think, is the future for the medical school. It will provide a lot of research and development. I think we'll get national recognition, and we're just proud to be a part of the donation of this and success of the school and the CEVT. Thank you.
Thank you, Bill. The family of Aaron and Peggy Selber are the other group that came together for this. They could not be with us today. Most of them live out of town, but I've had several conversations with them over the past couple of weeks. I'll be honest, this was a surprise gift. At first, it was anonymous. Dewey and Aaron Selber were close friends and business partners, and the family wanted to make a contribution in recognition of what Dewey really means to them and means to this community. But also, Aaron and Peggy were strong supporters of LSU Health Shreveport when they were alive. Aaron was a founding member of the LSU Health Foundation, and continued to support it up until his final days. So we truly thank all of the Selber family and their friends for their contribution to this. I think we covered everyone that's going to talk today, right, Lisa? I think that's everybody. Yeah, there you are. Okay. There are a lot of individuals in the room, though, today that are part of the CEVT. If we could all just give them a round of applause. Y'all stand up if you're sitting. Please stand up, and let's give them a round of applause. They don't stop. 7 days a week, 24 hours a day, we're doing something to combat this virus. So this is a momentous occasion for LSU Health Shreveport, but really in our minds, it's the start. It's not the end. It's the start of something very special for the CVT. And my hope in Dewey and Bill and Ray and the Selber family is that this will entice others to participate. Whether it's another $1.2 million or something else, it's important that we continue to support this center in LSU Health Shreveport. And so this pandemic may go away, but the next one is coming. And if we can position ourselves not only to be the ones to help to combat it, but and so that others do not get sick, but selfishly, it's a good thing for Shreveport-Bossier if we have an internationally renowned center right here in our own backyard. So private giving is one of the ways to make sure that that happens. And so thank you for this gift today, and we hope others in the future will follow in their footsteps. Thank you.